HealthPac is the health program of Alameda County and provides comprehensive healthcare services through a contracted network of healthcare providers. The Fathers Corp work has been a part of the HealthPac contract since 2018. Alameda County Healthcare Services Agency has invested $1.5 million total to incentivize clinics to make organizational changes, offer health services that are inclusive of fathers, and engage them in men's health.
It's given our staff, our employees, our providers, everybody involved, more of an appreciation for what fathers bring to the table when it comes to their health care and the health care of their families.
One of the priorities that we have is to try to address some of the issues, such as scheduling. Many of the appointment times are during the day when dad can't come to appointments. So we do have Saturday clinics, and we're going to try to advertise that to the dads so that it's convenient for them to participate in their child's health.
Our messaging was a huge thing, and our images, we've also changed the way that we incorporate fathers in our images, because it's always, the mother and the child. So changing that, putting more photos up of father and father figures throughout our clinics so it's more inclusive.
The Fathers Corp work at the community-based organizations and at Alameda Health System is important because staff and providers learn how to improve clinic practices to be inclusive of fathers and to reach and engage men in health services using the tools, resources, and assistance that are provided through the Fathers Corp program.
One of the benefits being a part of the Father Corp collaboration is that we can attend trainings, and as we bring on new staff members, we can send them to the trainings. So it's a culture change for us.
When you look at how men have been treated through the years, just in our system, the father-friendly principles is across agency, and it just helps men, it helps agencies be a little bit more aware of how men feel.
And so by implementing any of those levels of the principles, we're able to make movement into how it can be sustained from a short-term to a longer-term impact. The groups are so important to be able to have that open conversations about health conditions, whether it be chronic conditions, chronic disease, to child development and the stages of development, and what to expect at 18 months old compared to 18 years old.
We were able to refer some of our dads to the Father Corp Zoom group meetings that were being held online. So I think the online option is really important for the dads.
With all due respect, they had every reason, they had every opportunity to say, oh, we want to concentrate on that. But they went in more, because then they were talking more about getting men tested, getting men vaccinated.
It's made the consumers more knowledgeable of everything that goes on with their health care, everything that goes on with the health care of their families. It even gives them more information about different health conditions, health concerns, anything related to health care. When it comes to our center, the fathers really get more information about it. We want to continue doing this over and over and over, repetition, so that the fathers know that, hey, every week we can be involved with something that's going to give us information about our health care or information about their family's health care.
We, which is HealthPac, Fathers Corp, and First Five, learn how to work with each other to implement Fathers Corp and the initiative in the clinic setting. And we also learned that we do need more staff to support the Fathers Corp work at the agencies and clinics.
It's important to know that it's not done in isolation. All of our work is done in partnership.